Now to one of our top stories tonight, the Ministry of Health will re-evaluate its budget to deal with disruptions anticipated as a result of the withdrawal of aid to key health programs by the United States of America. According to Medical Services Principal Secretary Kimtai, the government is ready to handle any prevailing situation to ensure that there is a flow of services. This comes as the Health Director General, Dr. Patrick Amoth, assured the public of buffer stock for HIV and AIDS supplies to last the country for at least 6 months.
Countries around the globe have continued to brace for tough times ahead following the recent announcement by the United States suspending support for critical health programs. In anticipation of disruptions, especially in accessing HIV and AIDS, malaria and tuberculosis commodities, Medical Services Principal Secretary Kimtai says they will review the budget.
We are going to sit down with the Treasury and make sure that we continue funding support to those patients who are receiving ARVs, those patients who are on malaria treatment. The nets we must continue distributing the nets. So it's just a question of now changing or adding additional resources through the National Treasury as opposed to where we're relying on the development partners.
At the same time, the Ministry of Health Director General Dr. Patrick Amoth has assured the public that following the suspension of the U.S. President's Emergency Plan for AIDS Relief PEPFAR, the country has adequate strategic stocks.
That we have sufficient stocks of HIV commodities, be it antiretrovirals, be it the testing commodities. We have strengthened our supply chain pipeline in the last 1-2 years to ensure that at any given time we have more than 6 months of stock.
The Minister of Health says that some of the interventions in place to deal with anticipated disruptions include actively engaging with other development partners, international agencies and private sector stakeholders to secure alternative resources and fill the gaps in supply of essential medicine. Kenya is also emphasizing regional and global solidarity to support health financing. Other interventions include strengthening local pharmaceutical manufacturing to ensure self-sustenance. According to data from PEPFAR, as of September 2024, it supported 20.6 million people with antiretroviral drugs across 55 countries. This number includes 566,000 children. Kenya, which is largely supported by global initiatives, has 1.4 million people living with HIV and AIDS. Meanwhile, former President Uhuru Kenyatta has challenged Africa to harness the vast resources available in the continent to improve healthcare instead of depending on donor aid.
Let us be self-reliant by ensuring that we deal with the challenges that we have in order for us to be able to free resources for where they are most needed. I saw some people the other day crying, oh, I don't know, Trump has removed money. He said he's not giving us any more money. Watu wanalia. Why are you crying? It's not your government, it's not your country. He has no reason to give you anything. I mean, you don't pay taxes in America.
The former head of state made the remarks in Mombasa County when he attended the East Africa Region Global Health Security Summit. Nancy Okware, Prime Edition.